I am Dr. Resti and you are watching Sikociety. Ordinarily, people experience a wide range of moods and similarly display a whole variety of expressions. There are, however, those who experience distress in their moods and have lost the sense of control over their feelings, emotions, and behaviors. Mood disorders is a category of mental health problems or psychological disorders which includes all types of depression and bipolar disorders. For today's episode, we investigate further by presenting various cases of this type of psychological disorder and listen to commentaries of various doctors regarding them. We discuss the types, what causes these disorders, and the methods of treatment.
Mood disorders are disturbances in mood that are unusually severe or prolonged and impair our ability to function. There are two classifications of mood disorder, the unipolar and the bipolar. The only difference is that in unipolar, disturbance lies in only one emotional direction or pole, while in bipolar, excesses of both depression and elation, usually in an alternating pattern.
Unipolar or depressive disorders and bipolar disorders are characterized by the presence or non-presence of major depressive, hypomanic, manic and or mixed episodes. A major depressive episode is determined when 5 or more of the symptoms are present during the same 2-week period and represent a change from previous functioning. At least one of the symptoms is either depressed mood or loss of interest or pleasure. To name a few of the symptoms, you have a depressed mood most of the day, significantly diminished interest or pleasure, significant weight loss, insomnia or hypersomnia, diminished ability to think or concentrate, and feelings of worthlessness or excessive or inappropriate guilt. The symptoms do not meet the criteria for a mixed episode, and the symptoms cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. The symptoms are also not better accounted for by bereavement, that is, after the loss of a loved one. For a mixed episode, the criteria are met for both a manic episode and for a major depressive episode, except for duration, nearly every day during at least 1 week period. The mood disturbance is sufficiently severe to cause marked impairment in occupational functioning or in usual social activities or relationships with others, or to necessitate hospitalization to prevent harm to self or others, or there are psychotic features. The symptoms are not due to the direct physiological effects of a substance or a general medical condition. A hypomanic episode is a distinct period of persistently elevated, expansive or irritable mood lasting throughout at least 4 days that is clearly different from the usual non-depressed mood. During the period of mood disturbance, 3 or more of the following symptoms have persisted, 4 if the mood is only irritable, and have been present to a significant degree. To name a few of the symptoms, you have inflated self-esteem, decreased need for sleep, flight of ideas, distractibility, increasing goal-directed activity, and excessive involvement in pleasurable activities. The episode is associated with an unequivocal change in functioning that is uncharacteristic of the person when not symptomatic. The disturbance in mood and the change in functioning are observable by others. The episode is not severe enough to cause marked impairment in social or occupational functioning or to necessitate hospitalization, and there are no psychotic features. A manic episode is a distinct period of abnormally and persistently elevated, expansive or irritable mood lasting at least 1 week. During the period of mood disturbance, 3 or more of the following symptoms have persisted, 4 if the mood is only irritable, and have been present to a significant degree. The symptoms include inflated self-esteem, decreased need for sleep, more talkative than usual, flight of ideas, distractibility, increase in goal-directed activity, and excessive involvement in pleasurable activities. The symptoms do not meet criteria for a mixed episode, and the mood disturbance is sufficiently severe to cause marked impairment in occupational functioning or in usual social activities or relationships with others, or to necessitate hospitalization to prevent harm to self or others, or there are psychotic features.
Under unipolar mood disorders, there are 3. The major depressive disorder or the MDD, the dysthymia, and the depressive disorder not otherwise specified. MDD or the major depressive disorder is the most common among all diagnosed mood disorders.
May kasi
patient then had been diagnosed with a major depressive disorder, which is a severe episodic depressive disorder. For the past month, she had displayed severe lethargy and hopelessness. She had lost a considerable amount of weight and had for several times mentioned desires to commit suicide. Nothing could cheer her up. Whatever we did, she would still remain in her depressed state. And she no longer desired or showed any signs of interest to return to her duties in her organization.
Symptoms of MDD may be categorized into 4 domains: the affective, cognitive, behavioral, and physiological. Affective symptoms include feelings of sadness, unhappiness, apathy, anxiety, and brooding. Cognitive symptoms include thoughts of pessimism, guilt, inability to concentrate, negative thinking, loss of interest and motivation, and suicidal thoughts. A patient who is experiencing MDD also shows behavioral symptoms such as low energy, neglect of personal appearance, crying, psychomotor retardation, and agitation. Physiological symptoms include poor or increased appetite, constipation, sleep disturbance, disruption of the menstrual cycle in women, and the loss of sex drive. Symptoms should be present for at least 2 weeks and should represent a change from the individual's previous functioning. If the episode is the first one, it is considered single episode. For people who have had previous episodes, the condition is considered a recurrent one, and about half of those who experience a single episode eventually have another episode. In general, the earlier age of onset, the more likely is a recurrence. People diagnosed with MDD often have other psychological disorders related, especially anxiety disorders. If left untreated, it usually lasts for 6 months or longer, and possibly even 2 or more years. Some can experience single episode and return to previous functioning, while others have repeated episodes with either complete or partial restoration of earlier functioning between episodes. Highest rates of occurrence are found in the first month following the recovery. Statistics show that women are nearly twice as likely as men to experience MDD. Women report earlier ages of onset than men. MDD also shows high mortality. 15% of individuals who suffer from severe MDD die by suicide. Death rate increased by 4-fold among people over 55 years old, and those who are put to nursing homes have increased likelihood of death in the first year. The second type of unipolar mood disorder is the dysthymia disorder.
Justin has been depressed for more than 2 years now and has been displaying depressive mood symptoms like overeating. He's an insomniac, overly fatigued, and he's always tired for most of the day. When we invite him to family outings like watching a movie or watching plays, he hardly comes, and it takes him a long time to decide whether he would like to come or not. It is though he views his life as hopeless. He hardly tries things, and life for him is pessimistic, and that's why he's been diagnosed with a dysthymia mood disorder.
Dysthymia is a milder form of MDD, and the depressed mood is chronic and relatively continual. It is almost same as MDD, just that it may last for years, although the symptoms are not as severe. It also has an earlier age of onset and has a more gradual onset. Complaints of depression may become such a fixture of people's lives that it seems to be intertwined with their personality structures. Patients diagnosed with dysthymia also show less vegetative symptoms than those who are diagnosed with MDD. These vegetation symptoms include sleep, appetite, weight change, and psychomotor symptoms.